Hello, everyone, and welcome. Thank you so very much for joining me today. This is the first ever caregiver conversation for the IgG4ward Foundation, so I'm extremely excited to be here. My name is Catherine Preventure. If you don't already know me, I am the Director of Patient Advocacy for the IgG4ward Foundation. It is truly an honor and a privilege to be in this role and to be hosting this caregiver conversation. Today, we're going to dive into a beautiful conversation in the heart of living with a rare disease, specifically IgG4 related disease, which, as most of you know who are here watching today, that this is a condition that presents unique challenge to both the person living with the disease and the people that love them. We brought together an incredible panel consisting of two caregivers and one courageous person living with a rare disease. We all met recently and had a great conversation, which you will be able to watch in just a few minutes. And included in the conversation, we spoke about the complexities of the care, the nuances of the patient experience, and the shared journey of managing a rare disease. Our panelists provided, and were so kind to do so, a glimpse into their lives, offering strategies, which has helped them and their loved ones, which also help them navigate the unpredictable waters that come along with the rare disease. And what brought us here today is more than just an interest in rare disease and IgG4 related disease. It is a commitment to understanding. It is a commitment to advocacy, to learning from one another, to building a supportive community. Whether you're living with a rare disease or you're a caregiver like me, a healthcare professional, or someone interested in learning more, I am certain and I'm hopeful that you will find something to take away from today's discussion. Thank you, and I hope you find this webinar enriching, empowering, and inspiring. Please stay tuned after just for a teeny bit to hear some key takeaways and also some important upcoming announcements from the foundation. Thank you, and I hope you enjoy. Thank you, everyone, for coming and joining us today for such an important conversation for the whole community, whether it's the rare disease community or the IgG4 related disease community. Before we begin our discussion, I would like each of you to please introduce yourself quickly with just your name and what brought you here today, whether it's IgG4 related disease or another disease, and also if you're a patient or a caregiver. Josh, we can start with you, then Linda and Sabrina, please.
Sure, yeah. So I'm Josh Argall. I'm caregiver to a now 23-year-old son who is living with Duchenne muscular dystrophy.
Thank you.
I'm Linda Bamberg, and for the past 15 years, I've been a caregiver for my husband who has IgG4.
Thank you, Linda. Sabrina?
Good day, I'm Sabrina Riddle. I am an IgG4 patient. I was diagnosed in 2013.
Thank you, everyone. And again, thank you so much for taking the time to come and have such an important conversation with all of us. In a recent conversation that I had with IgG4 related disease patients, I found out that the average time to diagnosis was about 23.5 months, which is, in my opinion, too long for somebody to not know exactly what is going on inside their body, and also too long to not begin the appropriate steps to treat whatever is occurring inside one's body. Sabrina, could we begin our discussion with you by sharing your personal journey from symptom onset to diagnosis? And in that, could you include how long it took for you to get the accurate diagnosis, please?
Absolutely, thank you. So my journey began in 2011, January 4th, 2011, as a matter of fact. Began very innocently with pressure in my right ear. And after about 2 weeks, I developed a case of pancreatitis. Well, the pancreatitis resolved, but the ear issues never ever resolved. And so after a period of months, I think from January until May, the specialist says, let's get a CT. And that CT revealed a very large mass growing in my middle ear cavity and my middle ear and my mastoids. I think it's probably easier if I just say from that January 4th, innocent, oh, my ear feels underwater, until I saw Dr. Stone to get a confirming diagnosis in October of 2013, it was 34 months. And in that 34 months, gosh, I had 6 surgeries, a round of radiation. I have permanent hearing loss. I wear a cochlear implant now. Gosh, that time period, especially during the first 34 months, I can't tell you how many times I was told, this is non-Hodgkin's lymphoma. You know, we've sent your pathology off to 3 different reference labs. It keeps coming back, but something must be wrong. Something must be wrong. And so, my care team they didn't shy away from trying to get down to the, nuts and bolts of what this is, but they simply didn't know. It is so new.
Right. And that was very early on
Yeah.
in, what was known in the knowledge about IgG4 related disease. So you were also faced with that challenge as well.
Yeah.
Thank you so much, Sabrina. Linda, could you please share how much time approximately it took for your husband, Michael, to receive his diagnosis and a little about his journey, if you don't mind?
Sure. It took about 5 years for him to get his diagnosis. We spent the better part of the first year going to almost every medical specialist in our local area, and we kept getting the same no results. So after that, I decided we were going to go to a major medical center in a metropolitan area and try to get to the bottom of it. And even there, he got no diagnosis. To some extent, he was misdiagnosed as having idiopathic kidney failure, kidney disease, and malabsorption, sort of a wasting disease, because his kidney function had plummeted and his weight had plummeted for no apparent reason. So fortunately, he went into spontaneous remission for about 3 years, but then it came back. And both of those symptoms came raging back. So we went back to the major metropolitan location, and we were assigned, fortunately, to one of their most experienced nephrologists, who we went there every 2 weeks for maybe a couple months. And he kept saying, the kidneys don't decline that fast. That's just not how it works. And I'm thinking in my head, well, the kidney test may be inaccurate, but I think the scale is probably accurate. And he's losing all of this weight. So at any rate, after 5 or 6 times of this, he says, I don't want to see you back for 6 to 8 weeks, because it just doesn't happen like that. And then 2 weeks later, sure enough, yeah, down we go again on everything. And so I wrote through the portal, like a panic-stricken spouse, about my husband is wasting away before my eyes. His kidney function is almost, out of cushion to dialysis. And so if you can't help us, who can? And so he said, okay, come on back. So we came back, and I had to push pretty hard to get this, mind you, because he said, I don't want to see you. And I'm not the kind of person to push or to be assertive, but I didn't really have a choice. So anyway, when we went back the next day, he did a biopsy, and now we know it's IgG4.
Wow, what a journey for both of you. And again, you both have a similarity in terms of when the symptoms for Michael started and when Sabrina started. It was really early on in the knowledge about IgG4 related disease. Josh, could you share any similarities you have with Sabrina and Linda around your son's diagnostic journey? Did you run into some of the same challenges in terms of the length?
Yeah, sure. My son's disease is also a rare disease, so there's a lot of similarities. In his case, it's genetic, but it's not always inherited. You can inherit this mutation that would cause the disease, but it can also be spontaneous and just, random, right? In our case, that's what it was. It was random. There was no family history of it. It just happened. He around like 1, 2 years old, when he should be walking and or running or, like being more mobile and stuff, he had trouble with balance, was falling and whatnot. We lived in a small town at the time. We went to a bunch of local doctors and they kept on trying things. And finally I kind of got tired of it. And I'm like, all right, we're done with this. And we live in Wisconsin. We went to Milwaukee. We went to the Children's Hospital there. And honestly, now, in retrospect, they knew right away. They didn't diagnose at that appointment. They took some labs, but those labs, they knew what labs they were taking, and those labs revealed exactly what they suspected, which was his diagnosis of Duchenne muscular dystrophy. That was at 3 years old. And so, yeah, I mean, for us, I guess from the time we started until the diagnosis was about 2 years. So.
In a long time, especially too, as a new parent to a child, not to know what is exactly happening to your child. Thank you for sharing. In this community, as we can see just with the three of you, how similar it is, yet our experiences are so different as well. But there's still so many similarities. And I would like to share that my experience, again, although very similar, the biggest difference is my husband had no idea that his body was wreaking havoc. Um, and, really no outwardly symptoms. It wasn't until he went over the handlebars of his mountain bike, and had a serious accident, punctured a lung, and then they found some very large masses in his lungs. Um, so, I'm sure he would have started presenting with symptoms, and I'm not sure what journey that would have taken us on, probably a similar one to what you all have experienced. But I just wanted to point out the big difference in his case is we didn't know what was happening. And, we didn't go looking for a specialist right away to try to figure out that what was going on because he couldn't breathe or he was coughing. There were no outwardly symptoms initially. I would like to transition a little bit now to, and some of you touched upon it, how you guys advocated for either your loved one or for yourself, because I did hear a lot of that. And advocating for yourself or for a loved one is not easy. Depending on skill set, personality, whatever it may be, it's not an easy task to take on. So I'm really curious as to what are some really specific strategies that you each used, that helped you advocate. Josh, I'd like to begin with you because recognizing that, your son didn't have a voice as a baby and you were really and probably still are his primary advocate. So could you just share some communication tips that have been helpful in, communicating with healthcare professionals, or any other advocating tips that you have?
Sure, yeah. I mean, I think it's important to educate ourselves, so that we understand. I mean, we're not doctors, right? And I'm not saying Dr. Google, that sort of thing, but to get some sort of idea about what you might suspect and educate yourself on it so that you can communicate with your doctors about it. And it's important to know the disease so that you can advocate for yourself, especially in these because these are rare diseases. A lot of the doctors aren't very familiar with it, and so sometimes we have to educate them ourselves. I know that especially lately with Google and whatnot, people come in thinking that they're diagnosed with they should be diagnosed with whatever, all kinds of different diseases. But my advice would be to utilize reputable resources and perhaps, print them off and don't be afraid, bring them into your doctor and say, here, man, like I saw this. And if it's from a reputable resource, whether that's a journal or, a government website or something along those lines, then I think that they're more likely to rely on the information that you're providing. But what is most important is to always, throughout the entire journey, educate yourself, educate, and that way you're able to advocate for what you know you need and what you deserve. And it's not their fault, that they don't know about it or whatever. It's not uncommon. People that are able to go to clinic with somebody like Dr. Stone, in the case of IgG4 Artie, are extremely lucky. I mean, obviously he knows this disease better than anybody, and but that's not the case at your local clinic in your town of 2,000 people. It's just not. So that's I have strong opinion there. Educate yourself so that you can share that information with the provider.
Thank you so much, Josh. And I really appreciate how you touched upon sifting through some of your internet search, because, that is a rabbit hole that sometimes people get lost down when they're searching for information. So thank you for really identifying what to look for in regard to that. Sabrina, can I move on to you next? How did you communicate with your healthcare professionals during your journey? Even still, if you have to advocate for yourself, what are some effective tools that you use?
Yeah, my advocacy was more pronounced, I should say, in that 34-month waiting period. I happened to, back in 2011, that obviously predated the Cures Act. And so information sharing between healthcare providers was not as, it was not there. My insurer, who actually happens to be my employer as well, was an early adopter of the EMR. So information sharing within the walls was easy to do, but my care often was outside of the walls of that, integrated managed care system. So I kept a binder. I still have that binder, and I continue to add to it. But in that binder, I would keep records of every single visit, every phone call, as Josh mentioned, articles, reputable articles from the NIH and places, that, for every diagnosis I was given, differential diagnosis. So we think this is non-Hodgkin's. We think this is Wegener's disease. We think this is neurosarcoidosis. What does all that mean? And to be honest with you, Catherine, I pressed, when we talk about advocacy, please, you don't know what this is. I don't know what this is. Can we present it at some conferences? Can we present it at the Tumor Board conference? Can we present it at the M&M conference? Let's get more minds. There's got to be someone else out here who has a patient like me. I can't be, a unicorn out here in this world. And so that, as Josh mentioned, advocacy, it helped me pushing. And it wasn't that they weren't trying, they were diligently trying, but you only know what you know.
Right, exactly. And that seems to be a shared response among both you and Josh in terms of, not really blaming the medical professionals here, but it's more about getting the information out there, it sounds like. And thank you, Sabrina. I know you are an amazing advocate for yourself, and you really have a lot to teach the community, I believe, in terms of how you've gone about advocating. So thank you.
Thank you.
Linda, I would like to move on to you. And you also became an amazing advocate, it sounds like, for your husband, and maybe not something that was in your personality originally. But it really sounds like you have also done your research and found ways to get the information to help your husband get better care. So if you could just touch upon a little bit of that, what steps you took in terms of finding the right information on wherever you were looking for your research, and how you went about writing that wonderful letter to try to get your husband the appropriate care.
Well, like Josh and Sabrina said, I think the key to all of this is educating yourself. And back when Michael was first diagnosed, there was very, very little in the way of information, even for physicians, much less lay people available that we could find at any rate. So fortunately, I know a little bit about regular research, not medical research, but I knew enough to figure out what sources were more likely to be credible and less likely to be credible. So put more weight on the ones that are the articles that are more likely to be credible, for example, published in the Journal of the American Medical Association, New England Journal of Medicine, Lancet, American College of Rheumatology, things like this. And it's not as daunting as it may seem, because if they're well written, all of those articles should have an abstract, an introduction, and a conclusion. And all of those articles should say, in terms that you and I or our GP should be able to understand, what's the purpose of the research, what are their main findings, what are they recommending based upon this. And then if you do this, of course, you will see the same institutions popping up. You will see the same authors popping up. And so I thought, okay, so these are, more than average likelihood of being informed people. And so we took the top couple that we thought would be knowledgeable and hopefully be able to help with Michael's case, and did some more research on each of them, including looking at what clinical trials they were conducting and things of that sort. And so then I decided, well, we have nothing to lose. Let's write a letter to Dr. So-and-so. And so, we explained, okay, we've done our best to do the research, the background on IgG4. We can see from your articles X, Y, Z, A, B, C, that you seem to be one of the leading experts in this disease in the US. So I wanted, Michael speaking for himself, I have recently been diagnosed with IgG4. And I was wondering if you would take on my case. And then he presented a table of all of his recent blood test and other important test results, along with various markers along the way, sort of as Josh was alluding to earlier, and Sabrina with these notebooks. And he said, okay, we've got two questions. One is, I have received conflicting opinions as to whether I should go for my, I can't remember if it was third or fourth major prednisone taper, which I failed the first ones, or I should go to Rituxan. And I've got multiple opinions on this. So one, I'd like to know what your opinion is on which I should go for and why. And second, do you have any pilot studies or trials that I might qualify for?
So it sounds like you all took it as the approach of not just seeking the care from this expert, but also, taking the road to just try to get some information as well, which seemed to really help in your case.
Yes. And our first thought was, well, gosh, this expert is so busy. The first thing we have to do is grab their attention. So not that many people will put in a big chart or, say that they've read X, Y, and Z articles and talk somewhat sensibly about it. So once we did that, and then we wanted information, even if we didn't get a trial, about, sort of a fifth opinion by now of which treatment he should go for.
Excellent. Thank you so much.
Can I add on to just something Linda said? And it was that, having your caregiver, having a partner with you in the trenches to research who's the best in this, and listening to her say she wrote a letter to Dr. Stone. I remember after seeing Dr. Stone and getting the diagnosis, I live in Georgia. Mass General is not a 5-minute drive up the street. And so we began to research who's here locally, who's an expert. And June 14th, 2014, I wrote a letter to Dr. Kowashashi asking if she would take on my case that I was newly diagnosed. And so I say to the patients and the caregivers, find out who's the best in your area, and don't be afraid to write a letter or show up in their office and say, hey, can you help me?
Find the organizations that represent the disease, like now here, IgG4ward, or whatever it may be, because typically those people that are responsible for that organization have experience in this. They've been doing it for a long time. You know, you don't have to start out on your own and do it all yourself. If you can connect with others, connect with community, they can help out a lot.
And, you know, Sabrina, you kind of helped us transition into our next conversation in regard to some ways that your wonderful husband, David, has helped you and supported you in your journey. And some other, you can touch upon that, please, because I know he's been such an important support for you. But if you could also help share some tips with the community in regard to what are some strategies that you use to manage the physical symptoms that come up with your disease.
Absolutely. My particular manifestation of IgG4 presents itself by way of pachymeningitis. And so headaches and neuralgia, facial neuralgia are every day. It's an everyday life for me. And so David is very, 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 very protective of anything that would seek to disrupt, I won't say my peace, but anything that would cause me to cause a headache to come on. And it could be any small thing. Staying on a Zoom call too long will bring on a headache. And so while he's very stoic in nature, kind of the strong silent type, he accompanies me to my appointments and he listens. And sometimes I'll nudge him and say, why aren't you writing anything down? But he files it away in his memory, and will recall it to me whenever I'm in a place where I'm losing a little bit of hope. He'll say, now remember what she said. Remember what Dr. K said, or remember what, this particular ENT doctor said regarding your condition, and this is what you need to do. So he is my reminder of hope when I'm losing hope, to say, you can do this. We've come this far, you've got it. And I'm telling you, I know that there are, IgG4 warriors and other rare disease warriors out there who may not have a strong support system, but finding someone who can walk the line, toe the line with you is really important. And I'm thankful to have my David.
He's a special one, that's for sure. Thank you, Sabrina.
Mm-hmm.
Josh and Linda, could you both share some tips, some strategies that have been effective in helping provide support for your loved ones? Josh, we can start with you. Maybe one or two specific ways that you help your son.
It's really listening to them and understanding them and knowing, putting yourself in their position, understanding what they need. Also, I think this is really important. Know that they might not ask for help, and know that they might feel like they don't want to be a burden or interrupt your life in some way. I just think it's really important that you preempt that, and you let them know that it's never a problem. You come first, and if you have to leave a concert or whatever is going on, right? They matter, and it's okay.
Thank you so much, Josh. It's very important. All of that, showing them that empathy and compassion, I agree, is top on my list for sure. Linda, do you have anything you would like to add in how you support Michael?
Just reinforcing a couple of things that Josh and Sabrina said. I did everything I could to sort of take all the parts of the burden of the disease off Michael that I could. So I was the one who did the heavy lifting on the research. I was the one who sort of did the research on the disease and the doctors and on the interaction of COVID and the disease and Rituxan. Especially at first, Michael, because it involved his kidneys, he had a very strict diet that was really, really difficult. And so I spent many, many hours per week trying to figure out what could he have, because he had to have a lot of calories, but almost no protein and no sodium. So that was difficult, but I managed to deal with that. And then I go to almost all of his medical appointments with him, because it's another set of ears and another set of, I don't know, brain cells that might come up with some question that he didn't think of at the time.
Absolutely. Thank you so much. And I was also going to touch upon how important it is to be there and present at the appointments, as well as, like Josh said, just, being there for them at home, anywhere, if, letting them know that they're not a burden. And I think, in my situation, oftentimes I do that in indirect, nonverbal ways, because I think even bringing up that conversation about my loved one being a burden creates some uncomfortable feelings. So I try to show that in indirect ways. And a big support that I would like to share is going to his appointments with him. He's fully capable of doing this. But when Andy started his journey, he started at the height of COVID. So I was not allowed to go to his appointments. And that created a lot of stress, anxiety, especially because this is when he was being told he had stage 4 lung cancer or some other diseases that we have never, ever heard of. So it was a lot for him to try to process and then come home and regurgitate for me. So we saw the difference once I was able to attend appointments. And I'm like that, just like David. I don't write anything down in the appointments, but I file it away. And it comes out when it needs to come out. But it's really helpful for me to be there with the questions, for me to help guide his answers. So I do think as a caregiver, that's one of our really big ways we can support and, do it in a nice, gentle way. So I'd love to transition a little bit into exploring not just the physical impact of the disease, but the emotional impact as well, because we all know that plays a huge role in how we are feeling and day-to-day function. So I would like for you all to maybe share some insights and how you navigate that. How do you navigate the emotional challenges that come up on the journey, and maybe some coping skills that you have incorporated and that seem to be effective?
So I finally got to a place of accepting that two things can be true. Hope and fear can exist at the same time. And I struggled with that, saying, gosh, I'm afraid, but I shouldn't be afraid, because I remember Dr. Stone saying, this is not cancer, this is not going to kill you. But there are days when I really, really, I'm concerned about my own mortality and where this disease will lead, ultimately, and how my overall health will play out. So rather than replaying that over and over in my head, I picked up the phone and I called a therapist. And it has been most helpful, in addition to having my strong rock, David, talking with someone so that I don't project my fear onto him. Of course he knows I'm concerned, but I don't want him to know that I'm thinking, am I going to die? And so I can be honest with her, and she's honest with me in return, and helps me to keep things in proper perspective. And I don't know if having those conversations with the therapist is easier because I'm a woman and I like to talk, but I don't have any better way of saying that. But it's been the that's one of the saving graces for me in terms of managing my emotional health. And the emotional health plays a critical role for me in my overall health. So I'm glad to have reached out, have a therapist on call, someone who I can talk to, and not feel like I'll go back, because then in 2011 I felt like I was all alone. Now there's hundreds of thousands of us, maybe not hundreds of thousands, but there's several of us in this together, and we have the foundation, we have social media, to help when we need some, when we're losing control, for lack of a better word. So those are the ways that I've managed my emotional health.
Thank you so much. And thank you for being so vulnerable and putting that out there, because there is such a stigma around seeking help for your mental health. And so thank you for sharing that that was one of the most important ways that you could benefit your overall health. And like you touched upon earlier in our conversation, how important it is to have that support, and whether it be a caregiver or whomever to talk to. Again, if somebody doesn't have that caregiver living with them or being able to support them, having someone like a therapist is truly so beneficial to process everything that comes along with a rare disease. So thank you for sharing
And
that.
I think that, I don't know if any of the other IgG4 patients or rare disease patients struggle. The question that I often ask, and still as we're seeking answers, what did I do to cause this? What's wrong with my body? Why am I don't want to say a misfit, but why me? And
And that's a really big question to process alone.
yeah, it is.
So, again, kudos to you for trying to seek out that help to process that big question that I'm sure comes up throughout your whole journey, not just in the beginning or, pre-diagnosis, right
Yeah.
after diagnosis. I'm sure it comes up often. So thank you again. Josh, can you share a little bit about your being a parent and, the emotional impact that it might have on you as a parent, and having to also maintain your composure and being strong and supportive for your son?
Yeah, thanks, Kat. Actually, for me, this is the most impactful uh, uh, aspect of rare disease. And even when the question came up, I wasn't expecting this, but I could feel my heart just racing. This hits me hard. I'll be as brief as possible. But when my son was diagnosed, I was 24 years old. I was a single dad, and he's my only son. And in his case, it's a progressive muscle disease that's terminal. There's at the time no treatment, no cure. He was expected to pass by 20 years old. Having to deal with that, being the person I was, like I wasn't capable of processing it, honestly. Fully transparent, it took me, a solid year or whatever, to like get through it. And I dealt with some very, very difficult and dark times. But then I realized, like we were talking about caregiving before, especially as a child, like he was dependent on me. If I'm in this state, how can I parent him in the way that I want to parent the person I love? It just doesn't work. So what I did, and Sabrina spoke about acceptance, I did that. I accepted hope and fear, and I would call it radical acceptance. In my case, it was I had to accept everything that the disease had done historically, what's known, and face really all of my greatest fears, and accept that it can happen. Not accept that it will happen, but that historically it could. Only then, when I faced all truth, was I able to then take action to move forward? Because, as I say, historically, that's the past. The future, that's ours. But we can't create the future that we want without accepting, the past and what is right now. So, in my case and their cases, I'm sure as well, it was very dark and difficult and hard to accept that, what we know in the past that could happen to me. But that's when I began to fight and make the change.
Thank you so much, Josh. I really appreciate it. Again, I know it's such a hard question and a vulnerable topic, but again, like you said, it's one of the most important and impactful conversations to have when we're discussing rare disease and the challenges that come up for the patient and the people that love the patient. There's a lot, and that's why, Linda, I would like to hear from you. I just want to quickly say that I will be having further conversations in regard to the impact that it has on mental health, whether being the person living with IgG4 related disease and or rare disease, or the caregiver, because it's a very important conversation that we need to continue to have within the community. So thank you so much, all of you, for touching upon it today. Linda, do you have anything else that you would like to add in regard to how you and Michael have navigated the emotional impact of the disease?
Nothing so profound as Sabrina and Josh. But what they both said resonated with me quite a lot. But a more trivial thing that really helped us is exercise, especially outside. So, Michael is one of the lucky IgG4 patients who still has most of his energy most of the time and can do things. And so, like your Andy, he bikes a lot, and especially with our 20 years younger neighbor. So that provides him with, the physical exercise, the social aspect, and the competitive aspect of, I don't want this 20-year younger guy beating me. I got to keep up with him. So I think that's been helpful in both, obviously helping our bodies, but helping, what are those things called?
All of our endorphins, our happy
Yes,
chemicals
exactly.
within our brain.
Yes, the endorphins start
Yes.
coming,
Yes,
and the social aspect and the the physical benefits. So we've found that helpful to the extent we can manage to make ourselves do it.
absolutely. Thank you so much for sharing as well. And I would like to, I have connections with all of you in regard to this. And I have to say that, it's a benefit and also sometimes a little bit of a curse for my husband to be married to a clinical social worker. We often talk about our feelings and the impact of life on us. So he had no way of around this, and it never does. So we often have, ongoing communication in regard to how he is feeling. But like you, Sabrina, I know there were thoughts that Andy had in the beginning of his journey that he didn't want to share with me and burden me with and have me worry more in terms of his mortality and, what that's going to look like, leaving me with 3 boys all under the age of, at the time, 6. So, a lot to process. And also for me as a caregiver, I feel like I have these dual roles too, because I need to maintain my composure for not only my husband, but also my children, and to show them that, dad's okay, we're good, everything's okay, and not let our worries kind of seep out onto them. So thank you again. And we will, like I said, touch upon this a lot more in the coming caregiver conversations that are planned for the foundation. So I'm going to transition a little bit and kind of off a heavier topic into a little bit more of an easier one, maybe. I'd like to, we explored how we communicate, or how you all have communicated effectively with physicians in the healthcare profession. However, there's another area where I know I have had to learn how to communicate with, and that's communicating with family and friends and coworkers about the disease and the impact of the disease. Sabrina, I'm going to refer to you. Considering the challenges that, I know you work, I know you have a family that's very important to you, socialization is very important to you. So how do you manage all of that while living with a disease, but also, if plans have to change, appointments need to be canceled, going out to dinner, you have to cancel the last minute. How do you manage all that?
So I think probably the best way for me to describe it is that well, I won't say describe it. Really quick story. I worked all my career to attain this one position. I knew I wanted to be a risk manager, healthcare risk manager. Finally got the position, was awarded the position, and ended up having to step down from it because of IgG4. And while I don't know the degree that stress affects the disease, I do know how it affects me specifically, and the pachymeningitis, and the headaches. And so I functioned in this role, and had to go to my vice president and say, I appreciate the opportunity, but I can't do it. I simply can't. And it was the most heartbreaking thing that I've had to ever share, because I still didn't have a diagnosis then. I just knew I couldn't do this. Since that time, I will shy away from anything. Gatherings, work, conversations that bring on any level of stress, any level of stress. And I don't feel bad about it. I'm not embarrassed by it. I thought initially it was a reflection on me, like, what's happening with my brain? Why can't you comprehend? Why can't you retain? But let's go back to acceptance. I accepted that to some degree. I was experiencing some cognitive decline, and this was very necessary to take a step back. So my family has been very understanding, and they don't pressure me. My friends, they don't pressure me. They understand. And my husband will say, hey, it's a bad day. It's a bad day. We don't go out to eat. We don't go to that movie. I have very good days, but I'm also very, very aware of the fact that my energy is not what it used to be. And I don't press myself. I think it's important that you do what you're able to do. And I'm not going to say nothing more, nothing less, and that you just not feel bad about it, and listen to your body. For me, my body tells me enough is enough, kid. And I just flow with that. But from a work perspective, I continuously file for intermittent FMLA. So that on those days, or in those periods of time when things are a little bit more challenging than they normally would be, I've got the protection, where I can step away and just kind of regroup and get myself together. So I don't know if that answered it directly, but that's how I've managed.
Thank you so much. It was very, very insightful. Thank you. I appreciate that. And I also appreciate you mentioning the FMLA, because that is so important for not only the person living with the disease, but also caregivers.
Yes.
To make sure that they are aware that that is a resource that is out there to protect your job. If you aren't able to make it into work, and it doesn't have to be just for weeks. It can be an inconsistent, like you were saying, some days are just bad days, and we all have to accept that, including the people in our outer circles, I feel is very important. And it sounds like you have a great network of people, Sabrina.
Yes.
Linda, I know that we are married to somebody to similar men that have their personalities are very similar is what I'm trying to get at. And I know you have shared that Michael's a very resilient and positive person, as well as my husband. And I know that's been difficult for us to be able to have conversations with others because they don't quite understand based on how Andy's presenting himself and how he looks, outwardly, that his disease is as bad as it can get at times. So I'm wondering how you communicate with others when you're married to somebody similar.
With difficulty. Um, I guess I will say that early on, as I mentioned earlier, I decided I was going to try to take on the role of removing as many burdens from him that could be transferred to me as possible. So when people ask how he is and I give a semi-truthful answer, like, oh, he's doing really well. No, we're still not going out to indoor restaurants or concerts or anything. And they're like, but he looks great. He looks great. And I think it's, and then he'll say, I'm fine. And I think this is partly because he doesn't want to admit to himself he's really sick. That's part of it. And part of it, I think, is the whole male thing that doesn't want to be perceived as weak or fragile or ill. So I usually, depending on the situation, how serious it is, I'll either just be quiet or I'll pursue it. But this thinking about this conversation today has spurred me to make a change. And I have asked him, do you know how that makes me feel? When, I've just explained that you're really, in a frail condition, and you say, oh, I'm fine. It makes me feel completely dismissed. And I don't think you mean to do that. I don't think you understand you're doing that, or you don't understand that that's how I interpret it. But that's how it makes me feel. Could you please try not to do that so much? And he has agreed. So we will see going forward whether that improves anything.
Wow, great. I'm so thrilled to hear that this brought on, a very important conversation between you and Michael. And I'm hoping that maybe he can be a little more honest, because it does present a challenge. I know for me, if he's out there saying, oh, I'm great, no, I'm good. And here I am saying, oh no, I'm sorry, we can't make it to Christmas dinner because Andy can't get out of bed. So sometimes I think it is hard for our community, or whether it's friends, family, coworkers, to really understand, because sometimes, especially in our situation, Linda, things aren't lining up in terms of what the patient's reporting and what the wife is reporting. So thank you.
Therefore, it's also good to go to the doctor.
Yes, exactly. Yes.
You can give the real answer.
Josh, do you have anything you would like to add here in terms of how you communicate, some of these challenges that might come up with family and friends, whether you have to cancel, or even, I'm sure that was difficult with your son if there were things that he couldn't do.
Yeah, sure. I think that it's important. First, I'm sorry to say this, but we have to understand that not everybody's going to get it.
Yeah.
And unfortunately,
Thank you for saying that.
no problem. Sometimes even people really close to us, even if they seem to try, that they're not going to understand at times. But for me, it just all boils down to just being open and honest, open with our feelings, and honest about them and the conditions. I mean, that's all you can do. You could lead people to resources. And if you do that and they still don't get it and you try, I mean, us as caregivers, or, if you're living with a condition, don't beat yourself up over it. There's just some things that you can't change. You can't make it happen.
Thank you so much. And it's really important to say that, no matter how hard we try, we can't, no matter what, we're trying to help people and educate people on, we can't change their thought process. So thank you for highlighting that, because I think that is really important, because it can really bear a burden on the people that are trying to help others change
Yeah,
the way they're thinking. And
yeah, and to be clear, I'm not saying that these people might have a negative attitude toward it or whatever. It just doesn't register.
absolutely. Yep. Or, and for some individuals too, it's also could be a sense of denial. There are some folks that really don't want to really admit, again, we're going back to that acceptance, that this is happening to their friend or to their loved one. And especially if they're not around that person on a day-to-day basis, it's easier to kind of sometimes deny that that's happening. So that's also something I think that's important to keep in mind.
One more thing, as close as we are, to the condition, or if we're living with the condition, and as much as we've talked about before, educating ourselves, um, it, it's especially important because we are so close to it. The further you get away, grandparents or however they may be, right? Still your family, still they love you and they want to do things, but they just, I don't think that it's even reasonable to think that they could spend as much time learning about the condition, let alone living it. Obviously, we could live around it, but they can't learn about it. They can't dedicate as much of themselves to understanding it, to accommodate for all of the complexities that could present.
Yeah. Thank you again, Josh. Such insightful responses. I truly appreciate it. And I wanted to add in here too, because for me, I think when I was creating this question and thinking about this question, I thought about my own experience. And for me, the most important people that I have had to learn to communicate with about this disease is my children. And children are always listening. They're, no matter if you think they're not listening, I swear they have like supersonic ears, and they tune in on the things that they shouldn't be tuning into. So for me, I have learned that communicating with them about their father's disease it's important to be carefully honest. So they know what's happening, what is going on with their dad. Um, they listen, they ask questions, I listen to them. It recently just came up. My son thought that his father had cancer, and you know, this threw me off because we have continued to have these conversations. So again, we don't know what's happening in little people's brains. So I really wanted to highlight how important it is that even though these conversations can be uncomfortable, it's important to have them with the little people in our lives, because they're wondering what's going on. And, one of the ways that something that's really helped my children is and found comfort in is calling their dad's doctor Superman. So they refer to him as Superman. He's Superman. They just have this sense of hope, that Superman is saving the day, which so far he is. So that's been helpful.
I appreciate so much what you said, Kat. Honesty,
Yeah,
just honesty across the board. And
right.
with, like, we give them, what they ask for. You don't need to go all in, but what they're asking, what they need to know.
Exactly. Because, I don't want, like, my son made up that thought in his head that his dad had cancer. And I don't want these stories that to them create their own stories about what's happening to their father or what's going to happen to their father. So that's why, honesty is, and being careful in how you present it in terms of the words. And, I definitely don't use all the medical language, but it is so important. So our final topic is again another very important topic. And it's a challenging one, I think, for everybody that's been on this journey. And it's rebuilding trust in the medical professionals and the healthcare profession after experiencing such what we like to call in our house ping pong, back and forth between diagnosis to doctors, So I would like to just touch upon any strategies that you have all put in place to help you rebuild that trust and to learn how to continue to trust these people while you're learning a new diagnosis.
We're pretty fortunate in that Michael never had any serious misdiagnosis. All we received many, many, many non-diagnoses, but not anyone telling him he, had something that was with a life expectancy very short. So, so that made it easier that we didn't experience the big mistakes. But also part of the reason that I believe we didn't experience the big mistakes was because we tried our best. Once he was finally diagnosed, we tried our best to find centers of excellence or physicians of excellence. And so those people are going to be on average better informed than others. So I think we had a pretty good run of it. Although I would also say that because we had done so much research, if we happened to get a dud, we could tell it very quickly. It didn't take very long. And so
Back to educating yourself and how important it is to educate yourself. Yep, absolutely.
Absolutely.
Thank you, Linda. Josh, do you have any tips on rebuilding if you lost trust in the healthcare profession and how you've rebuilt that?
Yeah, echo again what Linda said, educate yourself. Also, as we said before, understand that not all these doctors are familiar with the condition. I can't speak to the progress in IgG4RD, but I can tell you when it comes to like Duchenne muscular dystrophy, the gene and the proteins weren't discovered until 1986 and 1987 respectively, or actually vice versa. And then since then, by the time 1986, it was in the 90s, mid 90s, they were already working on, splicing that gene and manipulating it in a way. And the first approval came in 2016, which was a medicine that worked on RNA to treat the genetic mutation. So if you think about that, from 1986 until 2016, what is that, 30 years? The people care, the researchers, they care, the doctors, they care. They want to treat this condition. They want to help you. It's just that, it's a rare disease. And I think that they would welcome resources. They would welcome information that you provide. I think actually, if you provide somebody reputable information, and they outright refuse, look for a second opinion at least. Don't be afraid to get a second opinion. There could be a lot of reasons that somebody doesn't recognize what's going on, and maybe somebody else would, or they're open to it. And actually, I think any physician, they should welcome a second opinion. It goes without saying, as far as I'm concerned, when it comes down to serious matters like this.
Absolutely. Thank you so much. Sabrina, do you have anything you would like to add? I know you had quite the journey.
I don't, I don't, my grandmother would say, do you have any aught in your heart? So I don't have any aught in my heart against, any of the medical professionals that I've encountered over the years. I generally move through life, with the thought that people are inherently good and they're doing the best that they can. And so with that in mind, I believe that it is my responsibility to help the physicians or the care teams who don't have as much knowledge as I may have. In fact, I've gone into several appointments and they've said, hey, this disease better than we do. Tell us what you need us to do. And one of a rheumatologist, I asked a question because at any moment I can find myself in the emergency department and I'm having to try to explain IgG4. And so he gave me kind of a one sentence script that is basically, listen, I have a rare, I think he says, I have a rare fibroinflammatory disease. Please consider that as you work up a diagnosis. And it has been helpful as the years have progressed. Obviously, more and more folks know about, more and more clinicians know about IgG4, but I just believe people are doing the best that they can, and I've not lost faith at all in medicine.
Thank you
I
so
think we're
much.
making advances.
Absolutely. And thank you for highlighting that statement too, because I think that is a concern for people, and it might not, boil down to lack of trust, but just anxiety in terms of people understanding and have to retell what's going on with you when you're going into the emergency room because, you need stitches for cutting your finger while you're cooking dinner or something simple like that. But, it's trying to, again, we're going back to the education and advocating for ourselves. And it sounds like that has helped you all navigate, in all aspects, whether it's with healthcare providers, new healthcare providers, family. So thank you so much. It really has been very
Oh,
helpful.
Catherine,
Yes, go ahead.
I wanted to add, I'm sorry, there was one thing, our phones are smartphones. And so I have, so that in the event I'm unable to speak for myself, I certainly have all that information in my smartphone, and I place it in David's smartphone as well, under, the medical conditions section, so that if something happens, this is my history. And so you know what to do, or
So
may know
important.
what to do. Yeah.
Yeah. Thank you so much for sharing that. Such an important tip. Absolutely. Wow, this has been quite the conversation. You think you can't learn more about something that you have educated yourself on countless hours and months, but again, rare disease, I feel like it's an ongoing education, and you learn more, the most in my experience, from the personal experiences of others. And so thank you. I'd like to please just have you guys share one piece of advice that you would like to say to somebody newly diagnosed with a rare disease, newly diagnosed with IgG4 related disease. If you could go back to yourself in that time, in the beginning, what would you say that you think would be helpful? Whoever would like to begin may begin.
Report everything, regardless of whether or not you think it's significant. Report everything, any change in your health status. Like I said, who would have thought that a simple feeling of, I just feel underwater, I can't hear as well as I used to be able to hear, was anything significant? I would have thought it's just, hey, you're getting older. And so just report that, and stay hopeful.
Thank you. Josh or Linda, would you like to go next?
Yeah, I can speak. Find community. There's so much strength in community. We're here. We're here together, and I've learned so much from Linda and Sabrina and you, Catherine. I appreciate your story, and it helps me understand better, and I know that I'm better for it. I'm going to be a better caregiver because of it. And just thank you.
Thank you so much, Josh. Linda?
I guess I would echo what both Sabrina and Josh said. At the time we started out, there was no community. Now, there may have been a community amongst this, a handful of physicians, but not amongst caregivers. And so I am happy that that problem is slowly becoming addressed. And then even if you're an introvert and a shy and quiet person, do not be afraid to advocate for yourself or your loved one. And don't be afraid to ask for a second, third, fourth opinion until you are comfortable, because the physicians who are dealing with evidence-based medicine are looking at averages. Well, probably neither you nor the person you're caring for is average. So the extent that you fall out of the averages, you are going to know yourself and your loved one better than the physicians will, even if they know the statistical averages.
Absolutely. Thank you all so much. I really appreciate everything that you all have had to offer in this whole conversation. It really has been so beneficial for everyone.